Hi everyone, my name is Michaela Davis, and I will be discussing with you my evidence-based practice proposal for El Dorado County, California. El Dorado County, California is a beautiful rural community nestled in the mountains of Central California. Two hospitals serve the community, and they are 56 miles of mountain roads away from each other. The population is approximately 193,221 people. There are 1,786 square miles of land with lots of open space. The largest city of El Dorado County is South Lake Tahoe, and it is home to the smaller of the two hospitals. El Dorado County is rich in history with such events as the Gold Rush. Health concerns. Substance abuse is a primary concern in California as well as the United States. There is a disproportionately high incidence of substance abuse in rural communities. Hospitalization for opioid overdose is 7.6% in California and 7.9% in El Dorado County. Emergency room visits for opioid overdose in California are 10.3%, whereas El Dorado County has an increased number at 12.3%. Opioid-related deaths in the United States in 2020 is approximately 16,416, and in California, the number is about 8,908. The number of drug-related deaths in El Dorado County is difficult to track because a local Indian tribe will not allow deaths to be recorded in public documentation. Health disparities. The literature shows that there is an increased incidence of substance abuse in rural communities is often because there is a lack of mental health resources, a lack of regional coordination of treatment resources, a shortage of rural physicians who can provide medication-assisted treatment, a lack of primary care providers, and a lack of physician support of medication-assisted treatment. Mental health disparities. Research shows that the treatment gap of substance abuse in rural communities is primarily affected by the availability of evidence-based treatments and mental and behavioral health resources. Transportation access. There are limited public transportation options in El Dorado County. Geographical location disparities. People often have to drive long distances to seek medical treatment. Mother Nature, such as snow or floodwater, can affect people leaving their homes to attend medical appointments. Lack of providers. As much as 2.5 million people suffer from substance use disorder, and less than 40% have access to medication-assisted treatment. Lack of services. Because providers are not incentivized to work in low-income populations due to low reimbursement rates and insurance coverage issues. Stigma of seeking treatment. Acceptability of substance abuse treatment center can be challenging. Barriers to acceptability in a rural community include lack of amenity in the rural communities, belief that treatment will not work or is not needed, feelings of mistrust and pushback from community providers. Community resources for substance abuse in El Dorado County. The most common form of treatment for substance use disorder include abstinence supported by cognitive behavioral therapy and medication-assisted treatment. Medication-assisted treatment is the gold standard for opioid abuse disorder. The Marshall's Care Clinic strives to offer low to no barriers to care. They accept all insurance options. This clinic offers medication-assisted treatment for substance use. They offer services for alcohol, opioids, and stimulants. They also offer cognitive behavioral therapy and referral services. They are overworked and often have to triple book appointments. They also operate outside the primary care practice model, meaning if someone is out the door, they will stay late or come in early to help. The California ED Bridge program offers 24-hour access to medication-assisted treatment for someone in acute withdrawal. This offers a bridge to treatment center. This program also offers referral services to those in need. The California ED Bridge program has 24-hour MD to MD hotline to call on how to provide and dose medication for treatments of patient in withdrawal. The Progress House offers residential 24-hour supervision and structured activity and outpatient services for substance abuse rehabilitation. They, however, do not accept El Dorado County insurance, but however, Placerville and Sacramento County insurances are offered or private payer. Substance Use Disorder or SUD Services Program is a governmental funded program to assist people in abstaining from substances. Evidence-based practice proposal. During my research on substance abuse in El Dorado County, it is apparent that there is a knowledge deficit among nurses, physicians, and community members on available resources. How will we, as providers, educate and refer our patients to appropriate services if we are unaware of the service's existence? To decrease the incidence of substance abuse, we will provide education on available resources to nurses and physicians. To educate the community members on resources available, we will have information booths at local events. Nurses and physicians will have compassionate care training and classes to help decrease the stigma towards substance use disorder. When nurses and physicians provide compassionate care, patients are more likely to trust us and come to us for help. People experiencing substance use disorder are people first and deserve our care and compassion. There needs to be a change in the culture for treating substance use disorder, and through education, there is hope that one day we will help decrease the incidence of substance abuse. Thank you so much, and I hope you guys have a wonderful day.